Let's just jump right into it. Welcome to the program, Laura.
Thank you.
All right, everybody at one time or another has had a run-in with the dreaded acne, zit, whatever you want to call it. We've battled with it. In fact, this morning I woke up and got a lot of cover cream on. Can you see it? Can you see the blemish?
Well, of course I can. Yeah, over 85% of people battle acne at one point or another.
All right, so we have a lot of investigating to do. What are some of the causes?
Well, Vicki, acne is actually an inherited disorder. It's actually a disease of the pores, where the pores will shed dead skin cells at a much faster rate of speed than normal pores, and these dead skin cells get stuck inside the pore, and the body can't exfoliate or slough those off. So we need to use products, the right products in the right way, to help the body get those dead skin cells to keep them from.
We are bombarded with infomercials that promise to take away the acne problems. They look great before and after pictures. You got a problem with those?
Well, the infomercial products that you see on TV, they're on the right track, actually. However, because they're selling the same set of products to everybody, oftentimes those products are pretty weak, and the skin tends to adapt to products. So they work pretty well for about 3 weeks, and then because the skin is adapted to them, the skin stops responding. So the way we work is we want to make sure that the skin, we strengthen your home care every couple weeks to make sure that we stay one step ahead of that adaptation process.
Okay, so it is important to pair the right product with the right person and their age. For instance, you know, I got really desperate once and I went to the teenager's benzoyl peroxide, and it just burned my face. You know, here I am at this age fighting wrinkles, and now I have to worry about acne. It seems unfair.
Right, right. Well, again, we want to use the right products in the right way. So products that are strong enough to get acne under control are oftentimes very strong, irritating, drying, and dehydrating. So we want to start off using them very slowly and allowing your skin to get used to them, and then we can keep stepping it up. So
one of the worst things, can you imagine, you know, is this what you advised your patients? Just do not touch? You know, who can do that? You need to tie your hands down if you see something that's glaring at you.
Yeah, absolutely. I know it's like almost impossible not to want to get it out yourself because you don't want to walk around with a big zit on your face. But one of the best things you can do is just take an ice cube and just ice it like you would ice an injured muscle or something. It's inflammation, so we want to have ice to bring it down. That's just one little tip that you can help to bring that down more quickly.
All right. So just as an athlete would, you know, a muscle, you know, or any kind of inflammation. Well, then some of the other quick tips. I've heard things like putting toothpaste on a zit. No, right?
You know, I'm not sure about that one.
It's not worked. There are so many myths out there. Well, talk to me a little bit about, and we want to talk about teen acne, which I imagine is very different from adult acne, or is it?
Actually, it's not. It really comes from the same process of those dead skin cells building up inside the pore much too quickly, creating these impactions. And so, again, we have to, you know, we treat teen acne much the same way as we treat adult acne, using products that go down inside the pore and deal with the acne where it starts.
Welcome back to Body Beautiful. Right now we're talking with Laura Cooksey from Face Reality Acne Clinic about acne, bad skin, how to correct it. We'll be taking your calls, and the phone lines are lighting up with all your questions about acne and skincare. Popular topic. Phone number 800-440-4884. We'll also be posting the number for the clinic as well during and at the end of the segment. And remember, any advice we give you today, you're certainly going to want to consult your own physician as well. Okay, before the break, we talked about adult acne, unfair. You're fighting wrinkles. Now you're worried about breakouts. What's the root of that? What are the possible causes?
Well, that's a real mystery to me, why some people don't have acne as a teenager, but then in their 20s and 30s, they come to me and they said, I've just started breaking out. One thing could be that there's a lot of pore clogging ingredients in makeup especially, and in skincare, and even in professional lines, even in the cream form of retin A, there's a terrible pore clogging ingredient that should never be given to people who have acne, only to people who want skin rejuvenation.
Okay, and one of the culprits, just
isopropyl myristate is one of the worst.
Okay, well that's a mouthful.
Yeah, and there's a list of pore clogging ingredients on our website. So,
so stay away from those.
Stay away from those, absolutely.
Okay. Now we brought you brought some before and after pictures. Let's go ahead and roll those because I want to jump into the phone calls. We have several callers who need their questions answered.
Okay.
Okay, he's got a pretty serious case, or is that cystic acne?
That is definitely a classic case of cystic acne.
It looks like it hurts.
Yeah, it was very, very painful for him. And interestingly enough, those types of inflamed acne are the easiest to clear.
And how is that?
Well, the acne is all on the surface, so it's very, very responsive to the topical products that we give to them.
Do you need to worry about scarring with that type of acne as well?
Yes, unfortunately, that's why we try to get the inflammation down as quickly as possible. We had him use strong antibacterial products, topicals, and he was icing his face a lot.
Okay, let's go to the next picture. Now, she's very swollen there. Is that, is that?
Yeah, she is swollen, and there was just a lot of inflammation in the pores, and again, she was using a lot of antibacterial topicals, icing a lot, and you'll see in the after picture, she's still a bit red. The acne is actually completely gone. She's still a bit red from the inflammation, and the redness does fade in a few months.
How long did this take?
That took 3 months.
Okay, all right, you have one more picture here? Okay, once again, and that's going into the hairline. Do you find that happens too as well?
Yes, yeah. They can definitely have acne in their scalp as well.
Okay, let's jump into some of these phone calls. Carmel from Fairfield, you have a question about your daughter. Good morning.
Yes, thanks for taking my call. I have a 15-year-old daughter, and she's been having the severe acne on and off for almost a year now, and her doctors finally put her on an antibiotic. And I'm a little bit concerned being 15 years old and being on an antibiotic.
What do you know what antibiotic?
It is called minocycline.
Yeah.
Is that something you're familiar with?
Yeah.
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 Should she be concerned?
Yes, that's a really, really great question. A lot of our clients who have come into our clinic have already gone the route of antibiotics, Retin A, other products, and unfortunately, antibiotics don't address the real root of the problem, which is these dead skin cells that build up inside the pore. Dr. Fulton says in his a book that he's written called Acne RX, that even if you had an antibiotic that killed 100% of the bacteria, it still wouldn't
address like a mechanical problem if you're not
exactly
removing the gunk that's clogging up the pores.
And I have some clients who have been on antibiotics for years, which I think is a travesty because then they become resistant, and there's a lot of superbugs out there that they can't treat because these people have been on antibiotics for so long, and it just doesn't work.
Okay. Thank you, Carmel. Carlotta, quickly, do you have a question?
Yes, I have an 18-year-old. He never broke out when he was a teenager, but as soon as he turned like almost 18, his face looks like the first picture that you showed on TV. And I've tried Murad, I've tried Proactive, I've tried over-the-counter. I don't know how to get him to. It gets so bad, it's like when he does pop on, it's like almost pus coming out of him.
Again, that sounds like cystic acne.
That's a classic case of what we call grade 4 inflamed acne, and I would love to see them come into the clinic because, like I say, that's one of the easiest types of acne to get under control, and we can get it under control in about 3 months.
Wow, that's amazing because it looks like it would never go away. It looks like it's really deep-rooted, but you're saying that this actually is easier. Okay, thank you, Carlotta.
Well, what we tell our clients is to just be careful about the foods that are high in iodides and also high in androgen hormones. And the foods that are high in iodides are salty foods, seafood, seaweed, milk products, and there's also a hormonal component in milk.
Okay, you open up that can of worms. Why? What's in iodides?
Iodides irritate the follicle walls.
Okay.
So it can be a problem. Also, another group called foods high in androgen hormones, which are peanuts, peanut butter, shellfish, organ meats.
So that can affect the hormone balance.
That definitely. We've had people get off of peanuts, you know, when they were mainlining peanut butter, and it really helped to get their acne under control. All
right, I promise we get to these calls. Kim from Alameda, do you have a question?
Hi. My doctor had me on Accutane, and it didn't clear up my skin, and I'm still having a problem with inflamed acne. Have you been able to treat clients in your clinic that have been on Accutane and haven't cleared up from it?
Kim, thank you for bringing up the topic. Accutane.
Accutane.
Wow.
We've had many people come into our clinic who have done not just one but several courses of Accutane, even up to 7 courses of Accutane. For some people, Accutane is a silver bullet. It really can get rid of their acne forever. There's many others that come in who Accutane didn't work for. And yes, we definitely have helped those people get their acne under control.
And of course, that's a very serious road to go down, because for young people, you know, certainly it's been really, for women, you know, what are the precautionary things?
Oh, there are
pregnancy,
so many.
it could cause birth defects, and
so many side effects. I would recommend going to the FDA website and just, you know, if you're considering Accutane, go do some research for yourself to see what the side effects are. There's some pretty bad ones.
All right, Kim, hopefully we answer your question. Let's go on to April from Ukiah. Good morning, April.
Hi. My question is also about my 11-year-old. Acne runs in my husband's family, and him and his sister both had the severe form that you showed on the pictures when they were going to junior high. But my daughter has severe blackheads, and I have no idea how to deal with blackheads.
Okay.
Yeah,
blackheads.
Blackheads, that's the toughest kind of acne to treat. We call it grade 2 acne, and you really need strong products that are going to go down inside the pore and really help to exfoliate the inside of the pore. And so we do have if you're not close enough to come into the clinic, we have a long distance program as well where we coach you in how to use the products that we send you.
Now, blackheads, and people relate to that as the skin being dirty, but that's not the case.
It's not. It's just where the sebum that's plugging the pore has oxidized, the air has oxidized the end of the sebum, so it's not dirt. It's,
all right. April, hopefully we answered that question for you. For more information about Face Reality Acne Clinic, you can call 866-477-3077 or go to facerealityskincare.com. We will be right back with more about acne and skincare. Plus, we'll try to get in some more phone calls on Body Beautiful. For you, for more information about Face Reality Acne Clinic, you can call 866-477-3077 or go to facerealityskincare.com. We will be right back with more about acne and skincare. Plus, we'll try to get in some more phone calls on Body Beautiful. Now, I actually know some people who they don't invest in a lot of expensive you know, cosmetics and whatnot, and they have a simple routine of just a little soap and water, you know, in the morning and at night, and that's it. They leave their face alone and they have perfectly beautiful skin. Are they just lucky?
Well, they didn't inherit. They were lucky not to inherit the disease of acne, so they can use anything on their skin.
All right, well, this is the first time I've actually heard it discussed as a disease, actually. So is this something, say you cure it or say you get a handle on it, is this something that goes away forever, or is this a lifelong kind of battle that one has to wage against acne?
Well, it can be, acne can only be controlled. At some point, most people grow out of it, and they don't know when or why, but as long as you have the disease of acne, you're going to have to use products to keep it under control.
Okay, and really quickly, stress. Sometimes it seems that acne will pop up just as, you know, you're stressed out or not sleeping.
Absolutely. There are, if there's weaknesses in the follicle walls, that's when they'll come up, and when you get when you get that good night's sleep, it'll go away.
Okay, and I have to cut you off. We're going to obviously have to get you back. For more information about Face Reality Acne Clinic, you can call 866-477-3077 or go to facerealityskincare.com. Thank you so much for joining us.
Thank you
Fascinating
so much.
topic. Join us at 11 a.m. next Monday for Medical Mondays. Thanks for joining us. Have a great day.